It's estimated about 1/3 of Americans ages 65 to 75 have some degree of hearing loss. While gradual hearing loss as we age is common, there are some things we should all be doing to protect our hearing throughout our lives.
First, it's important to understand how your hearing works.
When you hear a sound, basically what happens is the sound is channeled into the ear, and the sound vibration is then changed into a neurological impulse, which is then sent up to the brain to know that you actually heard the sound.
Your ear consists of 3 major areas: the outer ear, middle ear, and inner ear. Sound waves pass through the outer ear and cause vibrations at the eardrum. The eardrum and 3 small bones of the middle ear amplify the vibrations as they travel to the inner ear. There, the vibrations pass through fluid in the cochlea. Attached to nerve cells in the cochlea are thousands of tiny hairs that help translate sound vibrations into electrical signals that are transmitted to your brain.
Factors that may damage or lead to loss of hair cells include aging, hereditary factors, noise exposure, including both occupational and recreational, such as music and also sporting events.
Listening to music too loudly with these could be the reason for the 31% increase in hearing loss among teens in the last decade. Tight-fitting earpieces send sound straight to the eardrum and damage nerve cells in the cochlea.
It takes only 30% of those damaged hair cells to be destroyed to actually cause hearing loss. And with that, it's very important for people of all ages to protect their hearing.
Be sure to monitor your kids' listening habits and warn them about the dangers of listening to music too loudly, whether it is with headphones or in the car. Stress the importance of keeping the volume down at a certain level at all times, and be sure that they know that they need to wear earplugs to protect their ears at loud events, such as concerts. And don't forget, all of the same advice also applies to adults.
Another type of hearing loss is called conductive hearing loss. Conductive hearing loss generally happens in the outer or middle ear. When it happens in the outer ear, oftentimes it's from a buildup of earwax. So it's a good idea when you see your physician or audiologist to have your ears checked to make sure that the wax is not building up.
Some of the signs and symptoms of hearing loss may include muffled quality of speech and other sounds, difficulty understanding words, especially against background noise or in a crowd of people, often asking others to speak more slowly, clearly, and loudly, frequently turning up the volume of the TV or radio, and withdrawal from conversations or avoidance of social settings. If you think you might be having hearing problems, it's best to call your doctor or a hearing specialist to schedule an appointment. To prepare, ask your loved ones to help you make a list of your symptoms and for how long you've been experiencing them. Also be sure to write down key medical information, summarize your work history, and make note of any questions you'd like to ask the doctor. There are several tests used to diagnose hearing loss. Your doctor may do a general hearing screening to see how well you hear words spoken at various volumes and how you respond to sounds. Simple tests with tuning forks can help your doctor detect hearing loss as well.
When we do a tuning fork evaluation, it allows us to determine where the damage is happening in the ear, whether it's happening in the middle ear, which would be a conductive type of hearing loss, further in the inner ear, which would be the sensory type of hearing loss, or it could also be a mixed hearing loss where it is both conductive and sensory neural.
Audiometer tests are more thorough and are conducted by an audiologist. The patient wears earphones, and the audiologist presents a range of sounds at various tones and asks you to indicate each time you hear the sound in each ear. Each tone is repeated at faint levels to find out when you can barely hear.
Treatment depends on the cause and the severity of the hearing loss. It could be as simple as removing earwax, could be being fitted with hearing aid or hearing devices, or even a cochlear implant. It's very important if you suspect that you have hearing loss that you do seek medical treatment. Could be through your physician, an audiologist, or a hearing instrument specialist.
Unfortunately, you can't reverse hearing loss, but knowing you've lost some hearing means you're in a position to take the steps to prevent it from getting worse.